Hey you guys, welcome back for another study with me video for our series for the month. All month long I'm studying along from my FMP AGMP review book to study along with you guys. So make sure you have your paper and your pen as we go along. Today I will be covering briefly just the TB topics and things for you to quickly identify those and prepare for that for boards as well as in practice or any exams that you may be taking in class. Tomorrow, I will go over pulses paradoxes. Now, you guys, you make me so excited when y'all comment and give me things that you want me to cover because I am here to help you. So your feedback is everything to me, okay? So I felt like the best plan for this is to utilize these next 2 days. So under this video and tomorrow's video, you guys put in the comments more things that you want me to cover, and a part of my MP week give back to you guys next week. I will do videos based off of what you have requested, okay? So I probably just do more videos to celebrate because I already have some things planned for you guys, especially for my current subscribers. So those of you who are active, those of you who are subscribers, you will be available for some of my giveaways and discounts up and coming for celebration of MP week next week. So be on the lookout for that. But that's something I figured will be the best way. So it'll give you some more time to put up put up what you want me to cover in the videos and prepare so that you know what we'll be covering. And we'll get some more details as we get closer to that. But so far, the requested things have been Weber and Rhine, antibiotics, and asthma and COPD with, the GINA guidelines, the Global Initiative Asthma guidelines for the asthma section. So far, those are a few of the videos I'll do for next week. So again, utilize today to put it under today's video in the comments, things that you may think of you want me to cover, and also tomorrow under the pulses paradoxes video. Now, I'm not on the screen today. If you hear any cars passing by, I have a jam-packed schedule. So why I have a break, I am sitting in my truck and recording because, hey, if I say I'm going to do it, I'm going to do it, right? So let's study along and get into the content for today. But, I always like to give a disclaimer to you guys. So, if you're familiar with me and you know my scenario. Hey, y'all. But for those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I design resources and courses and books and things to help nurses and nurse practitioners be successful on exams, boards, as well as in practice. But there's no absolute in medicine. So I always tell you guys to take it as such. We treat on a patient by patient basis, but there are standards and guidelines, and they vary based on what is current that we do in practice. But also, that differs because on the exams, because it takes a little bit for the test, the actual standardized test for the ANCC and AAMP to catch up to what has currently changed in the guidelines. So I also provide that to you so that you know what to prepare for boards versus what we're doing currently in practice, okay? So make sure you're paying attention to those things, but give me grace as I'm telling you those things, because trust me, again, I always give this little soapbox and disclaimer that I look into these things, so I'm telling you what I know. But let's get into the TB stuff for today, okay? All right, you guys. So let's study. So from my review book, and I like y'all to understand, and I know it sounds so like, duh, girl, we know this, but I like to spoon feed you so you can know it from all aspects, right? So what is tuberculosis? What is TB? Can you tell me? Put it in the comments. But in the simplest terms, it's basically a lung infection that's caused by a bacterial disease. It's spread by airborne and respiratory droplets like coughs and sneezes, right? So it's a contagious issue that has been spread from a cough or a sneeze, being airborne droplet, that is a bacterial infection that then progresses to affect the lungs, right? Hence why we commonly see the coughs, and it could produce blood-tinged sputum, etc., right? But for the foundation, that's the main thing I want you to understand, and you know that, but I just like to say it so you can quickly think of it in your mind, because again, I like to give you the quick identification of how we would look at it and how you should do when you're studying, and then go deeper and then break it down into sections so that you can retain it, and then, see it in a test question style, right? So that we can go through it, right? So we got and we understand what TB actually is, right? So again, it's spread, a bacterial infection that is spread from airborne issues like coughs and sneezes that are in droplet form as well, that leads to a lung infection, right? We know there's vaccines that you can take to help to aid in the prevention of it, but that's what it is. That's what it is, right? Now, how do we test for TB? So we know what it is. How do you identify that? So, and let me take it back a few more steps, because, I like to tell you guys to think of it: assessment, diagnosis, evaluation, and treatment. So if we're assessing this, you need to know how they present. So again, they can complain of a cough. They can tell you they were recently in contact with others. They may have night sweats. They may have weight loss, not secondary to attempting to lose weight by any diet or any exercise or any other thing that can commonly result in weight loss. So an abnormal weight loss, fatigue, night sweats, coughs, that can be blood tinged sputum. So again, we have this bacterial lung infection that is transmitted by airborne droplet cough, sneezes, that causes a lung infection. It can be prevented by vaccination, but they may present with abnormal weight loss, night sweats, fatigue, cough, and potentially blood-tinged sputum, right? So those are your presentation. Those are those key identifiers. That blood-tinged sputum, that cough, those night sweats, those are key identifiers. So when you see that, it's like, okay, Brittany, when I say TB, you say. When I say night sweats, when I say weight loss, when I say blood-tinged sputum, you quickly think TB, right? When I say this, you say that, right? So I want you to start to think of those things. And I know you like, girl, I know this, or Brittany, where are you going with this? But again, it sounds so simple, but you'll see it in a scenario on boards and quickly dismiss it. And I just want to make the obvious, right? So anyway, so again, so assessment, that's how they're presenting. You know what it is. You know their presentation. And then, so diagnosis. So again, when I tell you, when I say diagnosis, I mean, how are we coming up with our differential diagnoses, or are there specific diagnostic exams, gold standards to confirm that diagnosis? So, with TB, there are common skin tests like the Mantel test or the PPD, and you also can do TB blood tests, correct? So when those are positive, that goes along with the portion of confirming a differential diagnosis for TB. But also, what is the gold standards for the diagnosis, right? So we're having those, but then to confirm that, the gold standards are chest x-rays and sputum cultures. Now on exam, they're not going to give you one versus the other to pick to say what is the one to confirm it, because it is equally both of them. And if they put both, it will say, chest x-ray and sputum culture. You know what I mean? But they're not going to put A as chest x-ray, B for sputum culture. So ingraining in your mind that both of these are utilized for the diagnosis and are gold standard. Now, something that we often talk about is where do you see this? On a chest x-ray, where is it typically seen with for TB? And it's commonly in that upper quadrant, but also more so in that right upper quadrant. So again, let's run down where we have been. So we know what TB is. We know how it presents, our signs and symptoms, those common and key identifiers of the fatigue, the cough, the night sweats, the abnormal weight loss, right? The blood-tinged sputum, correct? So now we're thinking of the diagnostics and the differential diagnosis to confirm those, right? So then we move on to any of the forms of TB testing, if it's via blood testing, if it's PPD, Mantel test, all of these are options. And the Mantel is that MANTAL Mantous. Okay, Mantous. And I know I am someone, again, I get to talking quickly. I don't even realize I talk fast until students tell me that I talk fast. And I guess it's because this is just how I am when I speak on things. But when someone is trying to learn, I have to try to reel it back in. So if you hear me going over and over, that's another reason why I do that for you guys. So again, we have the testing, the PPD, the Mantow, the TB blood testing, like the T-spot, right? And then our gold standards are that chest x-ray and sputum culture, right? So now you want to think about it, because there's multiple levels of tuberculosis, and that's where it gets into things. So if the patient has a positive TB test, however, you have conducted it, if it's a blood test, that the T-spot or the Mantow or PPD, and the TB disease is ruled out, that's considered a latent phase. So, ruled out meaning they don't have the symptoms, their chest x-ray, sputum cultures are negative, then you can rule it out, right? But the TB disease is actually diagnosed and considered a positive when you had that positive TB test, again, being that Mantow, the PPD, the TB blood test, that's showing positive, having a positive chest x-ray and or sputum culture, along with those symptoms that we commonly see, right? And having medical histories and things of that nature. So you're doing the full picture. So if you have all of that, that is what we consider as the active tuberculosis, active TB phase in diagnosis, right? So you with me? Everybody follow me? And so before we get into the treatments and when to and how to and what to do in those areas, let's talk about these indurations, because the induration is going to allow us to know when you need to consider these, like the PPDs, as a positive, because that's a part of the steps to get a confirmed diagnosis, right? So, PPD, we do that intradermal injection. You are going to assess that area within 48 hours and or 72 hours, right? And you're looking for an increase in induration redness, all to the area that the injection site was provided. So you need to, of course, know, and I know you know this, but of course you need to know where this was done. So was it the right forearm, left? You need to document and be able to follow those areas, right? So then you measure the induration. So the area where the intradermal injection was injected, if it's 5 millimeters, if you see a measurement of 5 millimeters, the people that fall into that you would consider this positive are those that fall into the immunocompromised population, like people who are who have like cancer, or those who have been diagnosed with HIV, the immunocompromised. Because think about it, any smaller area, you can't wait for it to be worsened or larger, I should say. And people who have been in recent contact with someone who was diagnosed with TB, right? So if they were recently in close proximity in contact with someone who already has a diagnosis of TB, 5 millimeter induration is considered a positive for those. So immunocompromised, and those with who are in recent contact with somebody who has been has a confirmed tuberculosis diagnosis, 5 millimeter induration is considered a positive finding. People who fall under the positive group set of the 10 millimeter induration are those like people who travel into those prevalent TB locations and like those Mediterranean areas within the last 5 years, right? So within 5 years in those common TB locations that are prevalent for TB, again, like Mediterranean areas, places that are highly populated. So places like hospitals, schools, prisons, daycares, things like that. And then also small children under the age of 5. So the small kiddos under the age of 5, they have the presentation and then they have a 10 millimeter in duration, that's considered positive. The people who have traveled to those prevalent areas, that's considered positive. Highly populated areas, you want to think about us, the healthcare workers, working in those highly populated facilities. 10 millimeter we want to consider as positive. And then lastly is that 15 millimeter in duration. And those are for our healthy people. So that's just the standard across the board. If it's nothing else, if there's a 15 millimeter in duration, it's positive for anybody. And so when you think of that, when we put all those puzzle pieces together, if one of these and you meet that criteria and it's a positive, you have the symptoms, you have the positive gold standard exam, the chest x-ray and or sputum culture, then we have an active diagnosis, right? And that's when we now can roll into the treatment phase. And so the treatment phase of the TB, we treat for 6 to 9 month span based on where they are. And then we treat by with INH, rifampin, ethambutol, and pyrazidamide, right? So I know. So I know I said a lot, so I'm going to slow it down. So your INH, rifampin, ethambutol, and pyrazidamide are treatments for TB. Now, the dosing and treatment regimen vary based upon the patient's presentation and whether they're in the active phase or latent phase, etc. So there's various, you may see variances in how you treat. And so for board's purposes, you're not going to see so specific as to the treatment options for those just because of how they vary. And it's based on a patient by patient basis. But one thing that I want you to be able to identify and know is that when the patient is in active phase of TB, you're going to utilize all 4 of those, right? And it is gauged on a 6 to 9 month treatment span. Now, those that are in the latent phase, it only warrants the 3 in the treatment option, okay? And so that's the main way that I like you to look at it, so that INH, the rifampin, the ethambutol, you will do in the latent phase, but in the active phase, you will want to do the INH, the rifampin, ethambutol, and the pyrazidamide. Make sense? Now, let me flip to that section of the book because, I like to go over the interactive portion of the review book as well. So, like I told you guys, I break that down in the book. So I like you to read it, hear it, understand it as you're reviewing. Write out your notes, delve deeper if you need to. And then we get into this interactive section so you can gauge your knowledge, write it out and see where you are. And then, reviewing your medications, if there's any contraindications or any things that we need to cover for that, and then going through your practice question and quizzing your knowledge, right? So what population, so this is level 1 of these questions, right? So what population is considered positive with the induration of 5 millimeters? So I want y'all to take a moment, think about that. Tell me in the comments. What population is considered positive with 5 millimeter induration with the PPD? So you should think about your immunocompromised population, right? And those that have been in close proximity of somebody who was recently diagnosed with tuberculosis, right? All right, next, what population is considered positive with the induration of 10 millimeters? And tell me in the comments what you think. Or what you know, I should say. So you remember that's the travelers, those who are traveling to those highly prevalent areas, like those Mediterranean areas in the last 5 years. Those highly populated areas, like thinking about us again, like the healthcare workers and those highly populated facilities, like hospitals, prisons, daycare, schools, etc. And then 15 millimeter in duration. What population is that considered positive with those? And that's everybody, right? Healthy people and everybody. If you have 15 millimeters, that's a positive test result, right? All right. So step 2, What is the gold standard diagnostic exam for TB? And you should say chest x-ray and sputum culture, right? And then lastly, how should we treat our patients that are diagnosed with active TB and latent TB? Tell me in the comments. I'll try to get to the practice question so I can ask you one of those. And so active TB, well, I'm trying to find us a TB question in the book. So active TB, you're doing them all, right? INH, rifampin, ethambutol, and pyrazinamide. And latent, we're doing 3, right? The INH, rifampin, and the ethambutol. And let's see if I can find you a quick TB question. All right, here's one. A 66-year-old female presents with complaints of night sweats, cough, and states that her roommate was recently diagnosed with tuberculosis. PPD test shows a 5 millimeter induration. What is the next step the nurse practitioner should take? Is it A, prescribe levofloxacin, B, obtain a chest x-ray and sputum culture, C, obtain an ultrasound, or D, none of the above? Tell me what you think in the comments. So definitely the answer for this is B. I tell you guys, whenever doing a question, read the stem of the question first to ensure that you are answering what they're even asking you. So the stem of the question states, what is the next step the nurse practitioner should take, right? So this patient came in, 66-year-old female, complaining of night sweats, cough, states that her roommate was recently diagnosed with TB, has a PPD that shows a 5 millimeter induration. So you're looking to see what the nurse practitioner should do next, right? So we talked about this. So key identifier, they already presented with those key issues, right? The night sweats, the cough. She was recently around somebody with TB, right? So now how do you start to progress to confirm the diagnosis that you should already be thinking of TB because of how they're presenting? You're going to do some type of TB testing, right? So the PPD was done and they have a 5 millimeter induration. So now you're trying to figure out, is this a person that falls into that category where a 5 millimeter induration is positive, right? And so it would be because their roommate was recently diagnosed with tuberculosis. So of course, right? So the next step, you want to confirm that diagnosis with our gold standard testing of a chest x-ray and a sputum culture. And then based upon that, that's how we proceed with how to treat, right? Okie dokie, you guys. So that's TB. That's the breakdown of the book and how I want you to try to gauge your studying with whatever resources you're utilizing. And think of it as I always tell you guys, assessment, diagnosis, evaluation, and treatment. Read it, write it, test yourself, okay? Rinse and repeat. Because I always say to you guys, repetition is the key to retention. All right, you guys. So that's it for today. Again, be sure if it's something that you want me to cover, to please put it in the comments so that I know. And I am happy to go over that. Next week is going to be that week that I really go into the things that y'all have been requesting thus far. But as always, thank you guys for watching. Please be sure to like, comment, and subscribe and share with whomever you may think may find this beneficial as well. If you want to contact me at the Nursing Studio, you can call me at 803-400-6864 to schedule any one-on-one sessions or review or inquire about any of our resources, or shoot me a quick email at the Nursing Studio with the number 1 at gmail.com. But if nothing else, be sure to meet me back here for our next video as we continue our Study With Me series. And make sure that you guys are subscribing so that you can be prepared for NP week and all the goodies that are in store. All right. Bye, y'all.